What are the side effects of Chantix? Make sure you stay to the end, because at the end, I'm not only going to tell you what the side effects are, I'm going to tell you exactly who should not take Chantix. Chantix is a prescription medicine to help adults stop smoking. Let me tell you a very common story, but a real one about a real customer of mine and his real experience on Chantix. This client of mine, Bob, had been smoking for about 30 years, and his father had died of lung cancer in his early 50s. He decided it was time to stop for good. He had heard about Chantix, a new drug that blocks nicotine from attaching to your brain receptors. That way, you stop receiving any pleasure from cigarettes at all. So Bob thought this would be great. So he got the prescription from his doctor, and he had it filled that very night. Then he went to sleep, and everything changed. He started dreaming about violent encounters with his neighbors. They were very vivid and very real. Bob had to stop Chantix because those dreams actually led him to become a sleepwalker. And early one morning, he dreamed his neighbor was attacking him. So he literally sleepwalked over to his neighbor's house, started banging on the door, yelling and threatening his neighbor. His wife had to run over and wake him up, and this sent Bob into a full panic attack. It was a terrible event, and it was incredibly jarring for Bob. So Bob stopped Chantix that very day. Now, Bob's wife, Emily, who also decided to do Chantix at the same time, did not experience this at all. Her dreams weren't vivid like Bob's. In fact, they really didn't have really much meaning at all. In fact, the medication made her feel kind of blah. She really didn't feel anything. So here's a couple the same age, smoke for the same amount of time, and they have vastly different experiences of Chantix. One had an unbearable experience on Chantix, and the other had just sort of mild side effects. Why do I tell you this story? Because as we go through this list of possible side effects, I want you to know that there is no way to know for certain whether you'll be a Bob or an Emily. The only way to know this is to take the Chantix. I tell you this story so that you understand that if you experience anything like Bob, it's best to stop taking the drugs or the Chantix immediately and speak with your doctor. Just so you know, Emily freaked out and decided to quit as well after she saw what Bob went through. That's when they came to me. Just for closure on this story before we go through all the side effects, they finished my program 6 years ago and they are 100% smoke-free. But this isn't about that. This is about the side effects of Chantix. So let's go through all the side effects, and I've broken them down for you between common side effects, the most common ones, and the most severe. And what you need to know is the most common ones happen almost 75% of the time. The rare ones happen less than 50% of the time. So let's start with the most serious side effects of taking Chantix. So if you have any of these serious side effects, you need to stop taking Chantix immediately. Some people have serious seizures during the treatment of Chantix. In most cases, these seizures, they usually happen within the first month of treatment. If you have a seizure during the treatment of Chantix, stop taking Chantix and contact your healthcare provider right away. The next thing is new or worse heart or blood vessel or cardiovascular problems. You get chest discomfort, uncomfortable pressure in your chest, squeezing or fullness or pain, especially if they last more than a few minutes. Or if it goes away right away and then comes back, stop taking the Chantix, call and ask for medical attention immediately. Next, people can experience sleepwalking with Chantix, and this sometimes leads to maladaptive behavior that can be harmful to you and other people or to property. So if you start to sleepwalk, stop taking Chantix and call your doctor right away. People also experience sleep problems like trouble sleeping, insomnia, or vivid or unusual or strange dreams. You can also have allergic reactions that can happen with Chantix. Some of these allergic reactions can be life-threatening, like serious skin irritations, including rashes, swelling, redness, or peeling of your skin. Some of these skin issues and reactions can actually be very harmful to you. So stop taking it immediately and call your doctor. Some people experience suicidal thoughts when they try to quit smoking on Chantix. This is very serious. You need to stop immediately and call a doctor right away. Those are the very serious ones. And if you have any of those, you need to stop Chantix immediately and call a doctor. Let's go through the common side effects now. These are the ones that over 50% of people experience on them. And you don't necessarily need to stop Chantix or call a doctor if you have these. Most common are an urge to smoke, a depressed mood, trouble sleeping, irritability, frustration, anger, feeling anxious, having difficulty concentrating, restlessness, a decreased heart rate, an increase in your appetite, weight gain, nausea, constipation, gas, stomach pain, vomiting, severe headache, feeling weak and constant tiredness. These are the most common, and they should really just be expected when you're taking Chantix. If you're going to use Chantix, you will need to be prepared clear that this is just part of the journey. We know that for some people, they can actually live with these side effects, and Chantix might be a bit of a hassle for them, but it's still worth it. You have to decide this for yourself. Now, I promise you who should not take it. Here's who should not take Chantix. Anyone with a pre-existing mental health condition or problem, such as depression or anger management issues. So if you have issues with aggressiveness, hostility, agitation, or if you're a person that has suicidal thoughts, stop taking Chantix immediately. Never take it, as a matter of fact. Basically, if you know that you actually have real issues with any of these side effects, you probably should not be taking Chantix, especially not if you have any known mental or psychological issues, including issues with stress and anxiety. Now that you understand the common side effects and the serious side effects and who should not take Chantix, hopefully you'll find that this video was helpful. And remember, only you can decide what is right for you. If this information was helpful to you, please subscribe to this channel. And look in the description below. I've put a link in there to my calendar. If you want more information or you want free advice on how you can quit smoking either with Chantix or without Chantix, take advantage of it. It's free, it's fun, it's just a conversation, kind of like we're having right now. So take advantage of it. So I want to thank you for all your time and attention, and blessings to everyone, and I'll talk to you soon.